Good morning, good afternoon, and good evening, everyone. My name is Olivier Defau. I'm a Director of Health System at VillageReach, and I have the pleasure to be moderating this breakout session, during which we're going to be talking about the lesson learned about trying to use data and put on some system into place, a dashboard system to manage the ordering, the need and the ordering of PPE for community health worker in Liberia. And for that, we will be joined by my colleague, Arthur Loryoun, who has about 12 years experience as a licensed pharmacist. And during those 12 years, he worked as a hospital pharmacist as well. He works at the Ministry of Health as the county pharmacist responsible for coordinating pharmacy practices in Liberia's central region, county of Bong. Arthur has been working since 2012 in a non-government sector in supply chain, and currently serve as a supply chain manager with VillageReach Supply Chain for Community Health Worker in Liberia project. Arthur, the floor is yours.
Thank you, and I'm excited to be part of this 16th TechNet conference. Speaking from Liberia, and I work for VillageReach as supply chain manager. So for this presentation at this conference, we will speak briefly on community health workers PPE efforts in Liberia. Lesson learned about trying to get visibility and data use during a crisis. The presentation will follow the following outline: Army community health workers for battle, supply chain, logistic tools for PPE procurement, and we'll share with you briefly some lessons learned. Army community health workers for battle. As you can see on the screen, far right on the screen, that's the picture of one of our community health workers who are working in the counties and working directly with the community members. The role of the community health workers is very critical in mitigating the spread and impact of COVID-19. At last mile, they are often the first point of contact by the community members to seek health care. They are particularly well placed to build on the foundation of trust they've established with the community members from day to day. They can communicate and implement even new and rapidly evolving community level response measures. They can contribute to community sensitization for COVID-19 and also emerging disease, as in the case of the vaccine for COVID-19 and other disease conditions that may emerge in a community. But to do this, they need to be protected. And so as a problem worldwide, the shortages of personal protective equipment have led to the increased COVID infections, particularly among health workers. And the community health workers are no exception. Because in fact, they are more likely to suffer the worst of the shortage of PPE, because more often they are deprioritized, they are not considered in any national qualification. Most of the efforts will go towards the health facility-based health workers and those at the hospital level. And so supply chain logistic tools for PPE procurement is a concern as we address the problem with the supply chain of PPEs for community health workers in Liberia. Now, just to give you some background, during the 2014 Ebola crisis in Liberia, there were some efforts to track PPEs, but those efforts were short-lived immediately after the crisis has ended. Most of the PPEs were not and currently are not part of the National Logistic Management Information System. So by the time the end of the Ebola crisis, it was difficult to track stock status information about PPE through the National Logistic Management Information System. There was no well-defined processes or standard in place that could collect such information regarding PPE. And in fact, as the COVID-19 outbreak hit Liberia, balances of PPE that were existing in the country were stock balances from the Ebola response. And there were concerns on the stock. The issue of storage and expiring were associated to these commodities because from 2014 up to this point, of course, the storage condition, once they were not appropriate, could add problem to the quality of the PPE. So those were the problems on stock that was still available for the COVID-19 response. Now, how to get PPE to any frontline worker who need it in Liberia was a bit challenging. The issue of knowing what to procure or what to provide to the health workers, first you need to have a determination of what is available and what need to be shifted. So we initiated an effort of forecasting, tools development, and then inventory to create a data-driven procurement process. Now, as we move towards that, forecasting tools were developed with some discussion with the Ministry of Health stakeholders that could be helpful in the qualification process of PPE for community health workers. The Ministry of Health Supply Chain Management Unit was a key stakeholder to work with in developing the forecasting tool. This tool informs their PPE procurement decision-making by filling the gap in data such as needed quantity of products and timing of shipments to ensure optimal and uninterrupted supplies of PPE. Of course, there are also challenges as we move ahead with the process of developing and coming up with the forecasting tools. The sense of urgency can prove challenging, of course, and lead to difficulty in alignment across stakeholders and at the level of the health system. Forecasting alone, of course, is not sufficient to getting the needed PPE to the health workers. And so solutions needed to be put in place to address these challenges. In a crisis, the requirement should be a decision not to regret the approach to planning and decision making. While it may not be imperfect, it may not be perfect, the process gave valuable directional information to begin procurement. And so an emergency qualification process must be linked to an emergency inventory and a procurement system so as to respond to the issues and the problems in a timely manner. Now, the qualification and forecasting data often need to be supplemented with data about what PPE stock is available, that is stock on hand across all levels of the system, so that the quantification and forecasting can be near to 100%. So that says the supply chain management unit needed So visibility into PPE stock, availability, of course, the cost of the stock, and the source of the stock at the national and county level, so as to provide the information what is available in every facility or in every county in Liberia. And so to be able to do that, an infantry dashboard was developed that will provide the PPE data visibility at the central level where most of the decisions are made, and then that will be used to inform procurement decision as well. So the dashboard that was developed was meant to address that. Now, even as the qualification tools development experienced some challenges, so was it with the infantry management dashboard. A lack of global standardization and constant changes to what PPE products were needed for the pandemic response and even where to acquire them was a big challenge. The inability to add PPE to current data process due to inflexibility of the national ELMIS. Now, currently in our supply chain management, we've got an electronic platform where all of the items, mostly other essential products, are incorporated into the system, but PPEs have not been incorporated into the ELMIS. So it was a challenge how such national system could be adopted and updated with new PPE items. Dual tracking needs a PPE already in country and the influx of donations that came in various sizes and forms. And to be able to prepare a dashboard, you must have a standardized listing of products that you will be tracking. And so to be able to overcome or address that challenge as a solution, the team created and agreed upon standardized product catalog that is flexible enough to be updated as the pandemic progresses. Meaning that as we move on with the intervention, that there were additional PPEs that needed to be visualized through the dashboard. The system is flexible enough to do that adjustment. And so based on that decision, selected a new tool based on the price agreed upon, the training, and of course, how adaptable that will be to other existing system or intervention. Also develop a data collection process or processing with the supply chain management unit. That template will be used to capture the data need from the service delivery point, from the community, from the county, and then sent over to central level for updating into the dashboard. Of course, when we did all of that, we needed to do a training and supervision of the process. And we work along with the supply chain management unit, conduct a training on that, and then the data collection was deployed into the county. Now, through all these, we've got to learn few lessons that we would love to share in this presentation. Your intervention can be good as is good. So good enough is good enough. Make sure that whatsoever intervention, we needed to have the ministry to play the leading role. That's the command center. So as we progress with all of the interventions, the development, we ensured that obtaining a buy-in for the ministry was a very critical point to consider. And also as a lesson learned, Data is the key to making any informed decision, but implementing new processes may take some time. So this is why our intervention, when we experience from the beginning of the intervention, there was no reliable data to inform PPE procurement or quantification. It simply indicated that data is very key to any intervention. So as a lesson learned, moving forward and scale up activities, we certainly believe that with the development and implementation of the dashboard, that will be suitable for providing data for future procurement of PPEs to respond to future intervention. And to say that it's a response to the present while designing for the future. With that, I would like to end this short but rather important presentation. And thank you for giving me the opportunity to share a little experience on what we've done so far on community health worker PPE's effort in showing that our community health workers are protected from COVID-19 infection as they carry on their daily work. Thank you again, and we look forward to sharing more when the time becomes necessary. Thank you.